Okay, so I think we'll begin. Welcome, everyone. Thank you so much for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General Hospital. Today's program is a special collaboration between the Blum Center and Mass General Cancer Center. Before we begin, just wanted to go over a few housekeeping items with you all. Please be aware that today's session is being recorded for educational purposes. If you're interested in viewing a recording of today's program, you can visit our website at massgeneral.org/Blum-Center. Please note everyone is in listen-only mode. Everyone has been muted to reduce feedback so that we can hear today's guest speaker. If you have any questions, please use the chat feature, which is located at the bottom of your screen. Only Blum Center staff, co-host, and the guest speaker will be able to see your questions. Please don't share any personal medical question or information in the chat box. If you have a medical question, please ask your doctor. Next, I would like to introduce you all to Devin Punch. She is the health educator for Mass General Cancer Center, and she will introduce you all to today's guest speaker.
Thanks, Amy. Hi, everyone. Thank you for joining us today. I'd like to welcome Dr. April Hirschberg. Thank you so much for presenting today. Dr. Hirschberg completed her residency in adult psychiatry at the MGH McLean Combined Psychiatry Program in 2006, and she has remained on staff since then in the MGH Department of Psychiatry, first in the Center for Women's Mental Health and later in the Cancer Center. She is an instructor in psychiatry at Harvard Medical School, and she has completed SMART certification, stress management and resiliency training. And that is with the MGH Benson Henry Institute for Mind-Body Medicine. Since 2018, she's been leading stress management and resiliency programs for individuals with cancer at MGH, and she is starting a program for people with hereditary cancer syndromes. Thank you, April. I'll turn it over to you.
Thank you. Thank you, Devin, and thank you, Amy. And thank you all for being here today. And I just really wanted to say thank you for having me today and allowing me the opportunity to be here and talk about some things that are really very important to me. And I've been pretty passionate about over the years. As Devin mentioned, I'm a psychiatrist, and I've been at Mass General now since 2002 when I came for residency. And I've been in various departments, but really my main goal is always to try to help individuals and patients try to cope and manage with stress and the stress of medical and mental health issues. And so being here today is just such a privilege to be able to provide some tips that I've come across over the years that I've always told people and some family members, which they probably don't need to always hear, but certainly it's a great opportunity. And also this topic about the hereditary cancer syndromes and cancer care in general. One of the departments I have worked at is the psycho-oncology clinic, as Devin mentioned. And I've had the opportunity to, care for people with cancer and people at risk for cancer. So, certainly that's a unique stress, and those are unique stressors. But all of these things I'm going to be talking about today can apply to all stressors. And I would be remiss if I didn't mention the fact that we are in a time of profound and exacerbated stress in terms of what's happening in the country politically and what happened with the Capitol this week, and also what the time that we're living in and the fact that we're doing this all virtual and that we're in the midst of a pandemic. So I think we all could benefit from some of these stress management tools and resiliency tips, and that's why I'm just so happy to be here. So we'll get started shortly, but the other part of my introduction I wanted to tell you about before I start sharing my slides is that one of the things, I'll just tell you a little bit about how I became interested in this particular subject, the hereditary cancer syndromes. I am from a pretty large family in Maine, and over 10 years ago now, while I was working at the Women's Mental Health Center at Mass General, one of my mom's my mom's one of 8, and one of her sisters was diagnosed with breast cancer, and it was found to be a BRCA1 related breast cancer. And that really started off a whole bunch of things within the family, as you can imagine, and a lot of testing. And so as the only doctor in the family, I became very interested in this area and trying to think of ways in which to help people who in fact have cancer, but also have the hereditary risk of cancer. So one of the things that I'll talk about too is I happened to do a review, a paper, so about 5 years ago now. So I'm going to present some of the findings in that review, as well as the the resiliency tips. I had thought to do it in one order, but again, given all the stress that's happened this week, I decided to do the resiliency tips first, and then provide some information about the review I did and some of the psychosocial implications of cancer genetic testing. So with that said, at this point is going to be my most stressful time of the day is when I try to launch my slides. So I'm going to try to do that now. Is that okay, Devin and Amy? I'm going to try to share my screen. So one of the things that, because this always provides me so much distraction. So hopefully this will just launch. And it looks like it is, so that's exciting. And I can see Devin and Amy, and they're going to give me a thumbs up, I think, once they can see it. Good, and you can see it, okay, good, great. So here it is, there's the introduction slide. One of the things, I've already told you this overview of what we're going to do today. And this is a great quote that I found recently from Lily Tomlin, who's a pretty famous comedian, who said, "The chief cause of stress is reality." And I think we are seeing that now, again, more than ever, and frankly, our history. The good news that we also know from history is that we are able to adapt and, adapt and also learn ways in which to accept reality, but also find coping strategies and coping tools in which to deal with this stressful reality that we're in, that we can not just survive, but learn to thrive amidst, these situations. And again, early on in the pandemic in March and April, I think it was much harder to think about ways to adapt and thrive, but we certainly all have, and we are all here today. So, so one of the things that I'll talk about is some of the impact that stress has on physical and mental health, but also some of the ways that we can respond to that and adapt, as I mentioned, and learn to cope with those stressors so that we can, even though we can't change the reality, we can allow ourselves to increase our ability to cope. And then that way we decrease our overall distress or the negative effects that stress has on our emotional and physical health. So that being said, here's this perfect example of the leopard here. And I feel like now I overheard someone saying like, "Oh, are you experiencing stress?" Someone was asked, they're like, "No, not really." But I don't know how anybody could say at this point in time that they're not experiencing stress. I think we've gotten so used to the chronic daily stressors that we're all in, that we kind of take this daily stress for granted because we're all living in it. So as I mentioned, resilience or resiliency skills is the ability to bounce back or cope with that stress. So one of the things, the big thing is adapting. And I've listed here breathing. We're going to do a tiny exercise on this in a few moments, and it seems silly to put that as the top thing to do to increase your resilience, but it's really true. Is that, again, going back to early on in the lockdown time, March, April, I don't know about all of you, but I was practically sometimes having chest pain because, you realize that you just are almost holding your breath, just given how stressful certain times can be. And as you know from your own personal experience, probably there's been times in your life that it's been feel almost hard to breathe. But if you consciously breathe and take deep breaths, it can be quite helpful. So I'll lead an exercise on that. And then there's all the obvious things like sleep, exercise, nutrition. We all know those things, but often those kind of go out the window in profound stress. And I can talk about how to kind of take back control of some of those things. I'm going to talk briefly about some mindfulness and meditation a little bit, and some ways to, bring our attention more to the positive and appreciation and humor and that sort of thing. So here we are. I thought about doing like a David Letterman sort of top 10. I don't know if anybody, I'm dating myself here, but top 10 like the resiliency tips to do. But I realized that there's only 7. And as Devin knows, since we've been communicating, slide preparation is not my strength. So maybe the next stop, I'll have the top 10 list. So, but one really important thing, and as you see, I have a lot of natural daylight coming in my window, but it's really important to get outside, even in the winter, and get a little fresh air, but certainly get some daylight, because that helps us set our what's called body circadian rhythm. And that keeps us, having wakefulness time when it's wake time, and then being able to go to sleep more when it's sleeping time. And it helps our body produce something called melatonin, and that occurs, that's a natural chemical that we have that's released, and it's supposed to be released, a couple hours before we go to bed. But if we're not getting enough daylight, it can be a little bit off. Or the other thing too is all of these devices, like this device and the one I'm looking into right now, all these light devices emit something called blue light, and that kind of messes up our circadian rhythm too, or natural wake sleep cycle. So there are ways to change that on your phone or on your devices. Like if you go to your iPhone and go in the settings, there's a way to do something called night shift. So like at 7 p.m., you're able to shift that to what's called an amber light. And that's, you don't want to have that blue light, and light from, the TV and all of that can kind of mess up, the ability to fall asleep. So a lot of people who come to me have trouble sleeping. So over the years, these are the things that I've talked with them about, trying to make some lifestyle changes. And a lot of people don't know about that on their devices. And there's something you can put on your TV too, and your computer, called f.lux. And that also helps decrease the blue light that you're seeing on screens. And the other thing is pretty obvious, but not something we often do, because a lot of people play catch up on the weekends in terms of sleep. But as much as you can, keeping a good sleep routine even on the weekends, remembering to drink water. So again, all these things. And the exercise piece, I know it's kind of annoying, and doctors always tell people to exercise, but it's actually true. You don't have to, well, I shouldn't say you don't have to. It would be ideal if you could get the 150 minutes a week. But if that's not the case, just making sure you get outside, like I said, or walking someplace safe, or even just getting up and walking around your house more instead of sitting, then you can improve your mood, frankly, and lessen your fatigue, which is kind of counterintuitive. And it can lessen anxiety as well. And so those are kind of the sort of more basic ones. And then the other thing, I'm going to talk to you about the stress management. Devin mentioned I do the stress management course and resiliency training course. And one of the hallmarks and sort of parts of the program that we start on day 1 is that we encourage participants to write down their appreciations. And I'm not talking profound gratitude appreciations or even keeping a gratitude journal. I'm talking about small appreciations that occur throughout the day, that you might not be noticing, because our mind is so focused on sort of the negative and potential dangers that it's not as practiced on finding the positive. So if you really appreciated that cup of coffee this morning, that can be an appreciation, or looking out your window and seeing a cardinal, fly by your window. So there's just small things we can really appreciate, and nature's a great place to find that. And the other thing is, do something fun. Even in a pandemic, and even, in the midst of, national chaos politically, it's still okay to do something fun. And it's really, frankly, important. So if you're having trouble sleeping and, you're still watching the nightly news at 11, I'm going to recommend you stop doing that. And it's not that I don't want people to be informed, but I started doing this years ago myself. When my kids were younger, we used to tape the 6 o'clock news and then watch it after they went to bed, just to make sure we didn't miss things. And that seems very old school now. But the but we stopped doing that because all the news is stressful. And shifted more to watching maybe a comedy. They have these things now, you can just watch them without the commercials, 22 minutes, and it can put you in a much better mood before you go to bed than watching the nightly news. I'm not saying that people shouldn't be informed, but you can certainly read your news or listen to it. But so that's that. And so this gets me to the breathing technique. It's a little weird to do in a situation when I can't see anybody. I'm used to doing this in person with people, but remember I told you that number one tip is to just breathe. I just want to demonstrate why this is actually so helpful. So what I'm going to ask you to do is, while you're sitting here, and maybe we can have Devin and Amy do it too, so I can see them, but you don't have to. But what I'd like people to do is just make fists, just like this, and make fists in their hand with their hands, and just squeeze as tight as you can in making those fists. Squeeze as tight as you can. Okay, you can stop and relax your fists. And at this point, I would ask what you might have done and what you might have noticed. And most people will say that they noticed they were holding their breath while they were doing that because they were so concentrated on squeezing their fists. So that's what most people do. That's what we all do. So when we do that, you can see how that's just a demonstration of how quickly our breathing or lack of breathing really causes our muscles to tighten and get pretty, rigid. And that's the same for our muscles of what's called respiration or breathing. And our diaphragm is actually our biggest muscle. And the diaphragm, if we're walking around kind of stressed and not breathing deeply or practicing those deep breaths, then we actually are not expanding our lungs fully, and we're not getting the full capacity that our lungs have to oxygenate our whole body. So by practicing deep breathing and taking 3 deep breaths an hour, then you can actually increase your lung capacity. So now what I want to do is just have you consciously breathe, making sure you breathe and don't hold your breath. And then what I'd like you to do is, again, try to make those fists as tight as you can, but consciously breathe. So go ahead and squeeze as tight as you can, but remember to breathe. And then you can relax. But what you might notice now, and maybe you don't, it's hard for me to say what to do and then try to practice it. But I know, again, from experience, that it's much harder to make a tight fist. You can still tighten it, but it's not as tight as the first time when you were not breathing. So that just is, again, a very quick example that actually taking those deep breaths does allow our muscles to relax, our diaphragm to relax, the oxygenation to increase. And by providing greater oxygen to our brains and to our whole body, we're actually doing a great service to ourselves. And we can increase our concentration, we can increase our relaxation, and we can actually increase our oxygenation. And that's really important. And that's going to get important too when I'm talking about sort of acting as your own antioxidant or acting, in your own best interest to lower your overall stress level and the damage that the stress can do. So that's a little example. But that also leads me to talk a little bit about the Benson Henry Center, which is where I learned about all this stuff. Dr. Herb Benson is a cardiologist. He's still around, and he was, back in the day, he was studying hypertension or blood pressure at Harvard, and he and his colleague, Dr. Wallace, were approached by some meditators, transcendental meditation experts, and who told him that they were able to control their blood pressure and their heart rate by meditating. And so, as he tells the story, this was back before you needed a lot of IRB approval, and he discovered that these people were right. They could. Their blood pressures lowered, their heart rate lowered, and what he found was, with that lowering of blood pressure and heart rate, that they had overall many other health benefits. So he wrote the book, he basically coined the term the relaxation response. And I'll tell you a little bit more about that. But that relaxation response book was published in 1975 and really talked a lot about how important it was to take time out of the day, break the train of everyday thought, and give your brain a break. And again, that's the simplest way to say it. But back, he originally was at the Beth Israel, and it was in 2006 that he came to Mass General with the Henry part of the Benson Henry is John Henry, the owner of the Red Sox, or co-owner, and the Boston Globe. So with some money from him, he came here. So that's that institute, and I put the website on there because it's a really great place and has tons of tips, and most of everything I'm talking about today can be found there, and a lot of the research as well. So going back to what I initially talked about is stress, because that's why you're here listening, is you might be experiencing cancer, or the stress of thinking about being tested for cancer genetic testing. So that's a stress unique to you. But unfortunately, as I mentioned, the reality is we're all in stress, and everybody has different stressors in their life. So the important thing to realize is that there are large stressors, which we've mentioned, the pandemic, the political situation, and then there's the small daily stressors like logging onto Zoom, or making sure your kids can get to school if they happen to be going to school, or if they're not. So tiny stressors, and then there's acute stressors, like I said, like something that happens immediately, maybe a car accident or a diagnosis. And then there's chronic stress. Some people are living in a chronic stressful environment, or even an unsafe environment that's stressful. And then the thing about stress too is it can be happening in the actual moment, but it also can be something that you might remember from your past, or something you might be foreseeing in the future. So stress can be something in the present, right in front of you, but also in our minds. So also the fact that we perceive stress is important, but the fact that if we think we can't cope with that stress can make the experience of that stress even worse, if you get what I'm saying. So what we're trying to do is try to find ways to lower the overall stress and increase our perception that we can actually cope with stress as it arises. So as I've kind of alluded to, when we're stressed, our body begins what's called fight or flight. That sort of feeling that you get, like if you almost get into a fender bender, or if you have to really stop short because somebody's crossing the street, your body immediately goes into fight or flight. You have an increase in your heart rate, your blood pressure, stress hormones are going up, and you are ready to take action. And that's the sympathetic nervous system. That's a part of our nervous system that controls the blood pressure and the heart rate, like I've keep on talking about. But the good news is, and something I just mentioned all of this, is that we have, like I had said, is Dr. Benson described, and what's been borne out by other doctors, not just him, is we do have the ability to combat that. So we do have what's called the parasympathetic nervous system. So we have the opposite ability to fight off the fight or flight. So we have something called the rest and digest system, but we just haven't learned to practice that part of our nervous system. So life has unfortunately given us so many opportunities to practice our stress response, but we've often not been given the tools to learn to practice the body's relaxation response. So I'm going to talk a little bit about how Dr. Benson talks about it with people, and also introduce the concept further. So the relaxation response, as he describes it, is the opportunity to repeat something, a thought or a phrase, or even an activity like movement, like knitting or yoga. If you repetitively do something and try to concentrate on just that one something, and then you disregard the everyday thoughts like, what am I going to get at the grocery store later, or that kind of stuff, then you are able to break the train of everyday thought and give your brain a break. So it's different from sleep when you're giving your brain a break. It's a daytime break for your brain. So, the other important thing on this side is, while doing that and allowing yourself the opportunity to give your brain a break, you have to have a non-judgmental attitude, because the reality is is if you quiet your mind and don't get distracted by all the things you have to do, or watching the news, or washing the dishes, then actually your mind, you realize how busy it is and how many stressful thoughts are there. So it's okay to have those thoughts, but just just kind of notice them and know that you are not defined by your thoughts, even though it feels like it sometimes. So just be aware of them and try not to judge yourself, which I know is really hard. So, because if you can do all that, you can alter your body's response by lowering your blood pressure, lowering your heart rate, and improving things like memory and concentration. So again, I've kind of talked a little bit about this. It doesn't have to be meditation. You can do other things to do this. And the other thing that's on here is mindful awareness. So that's another big thing. Like if you've been in the supermarket recently, you've probably seen it, at the checkout aisle of the magazines. But mindfulness or mindful awareness is just another opportunity to be in that present moment and not judging all the things about it. I used the example recently with someone, like if you're drinking a hot cup of cocoa, it's just enjoying that hot cup of cocoa. It's not thinking about the fact that you wish you had more marshmallows, or like stressing out that you've just drank the last of the hot chocolate. It's just trying to be present in that moment and enjoying that without judging that moment. So that's just a simple example there. So this is all to say that all these things, these types of things, like engaging in these relaxation response behaviors and doing the appreciations, like I mentioned in this program, and other lifestyle changes, like making sure you try to get the exercise and encouraging some, healthy nutritional lifestyle changes, have shown to bear out benefits. So this, when I use the abbreviation MBI, that means a mind-body intervention, and that's kind of what, I've kind of given you a little bit of flavor of the things that happen during those programs, in doing the breathing exercises and the appreciations, that these types of interventions have been shown in studies to actually decrease depressive symptoms, decrease anxiety, and decrease what's called perceived stress. So like I said, you have stress, we all have stress, but it's whether or not we perceive that stress is too much to cope with. So even though we can't change reality, we can help increase the coping with that stress. So the big study, and it's on that website I talked to you about, is that by doing some of these things, that we're able to actually find, the Benson Henry program found that healthcare utilization actually went down in people who have taken this program, because again, we can't take away the stress and stress often can worsen things like blood pressure problems or asthma. It can lead to the increase in anxiety and depression, and that can lead to other things like, I noticed during the height of the pandemic, like my jaw was hurting, and I called the dentist, and they thought it was probably I was, grinding my teeth at night. So a lot of stress, things that happen are due to stress. So if you can improve or lessen that stress, you can lessen trips to the doctors or even the dentist. So, so that's that. And so again, how does this relate to the cancer genetic testing and all of that and the cancer syndromes? Well, they have done, the Benson Henry program has done some very brief looking at the relaxation response training. So you don't even have to do the whole 8 weeks, but if you can just do 3 brief interventions, they found like women who were awaiting the results of a breast biopsy, if they did this while waiting, they found a significant decrease, because they compared them to a control that didn't have this, but they found the people who had these relaxation response sessions were actually having decreased anxiety while awaiting those results of that breast biopsy. So that really got me to thinking, like, how could that then help people who were at hereditary cancer risk? So meaning that you have a diagnosis of BRCA1 or 2, or there are other genetic cancer syndromes that increase your risk for colon cancer. So, and many others now as time goes on. So if if you could decrease some of that stress, could you show some improvements in overall quality of life and decrease, anxiety that might be associated with that knowledge. So this is just kind of a little bit of medical speak, but so just another reminder for me to tell you that the mind-body medicine and these types of things like the relaxation response and the breathing and the appreciations. So this CBSM stands for the cognitive behavioral stress management. So we do SMART, which is stress management and resiliency training. And this other program did something similar, but it's called something different, but found a decrease in inflammatory markers in people with breast cancer. So people who did that program had blood tests and showed that there was a decrease in their inflammation by looking at their blood. So, and there's also some, I didn't mention Tai Chi, but Tai Chi is one of those things like the yoga that can be a part of the relaxation response. And if you do Tai Chi, that can also decrease inflammatory markers. And that was shown in breast cancer survivors. So it's just another, and the other thing just to mention is the SMART program has been looked at in terms of inflammatory bowel disorders. So that's one area of research. And certainly, as Devin mentioned, I've been doing the SMART program for cancer survivors. So people who have completed their cancer treatment then get enrolled in the program, and they do show improvement in their quality of life for sure. So that kind of pauses that and kind of leads into this next session. I'm just going to look at the time and we're on time, so that's good. And so one of the things in terms of cancer genetic testing, so some people who are watching this program may be thinking about it or may already know that they're at a higher hereditary cancer risk, or they have cancer and they know they have this gene that might put them at risk, and that might have been why they're predisposed to cancer. So I am very interested in this area, as I mentioned, and I wanted to find out that, like, did having this knowledge put people at a greater risk of depression or anxiety? And remembering I'm a psychiatrist, that's what I was interested in. And what the research has shown is, even though there were some initial concerns that this knowledge that you're at higher risk for cancer would cause distress or higher levels of distress, that wasn't found to be the case. A small percentage, less than a quarter of people do experience some distress, and it was measured as distress, not depression or anxiety, but distress. And that was relevant, meaning that they could appreciate and need a referral to some, counseling or some other program. So, but the good news is that, and I'll show you on an additional slide, that distress goes down after a short amount of time period. So, but the important thing is that responses are really varied. Not everybody responds, with stress, with this knowledge. And like I mentioned, it's hard to know how distress was defined, and that's a very individual experience. So the point of the story is that if someone is distressed while they're going through cancer genetic testing, what are we doing about it, and what are the genetic counselors doing about it? So I put that reference from my review paper in Cancer from about 5 years ago here. If you wanted to check that out, it was in 2015. And a lot of these next few slides are from that. So again, looking at the different aspects of the genetic counseling session, and some people who are watching today may have seen some of the other Blum Center programs from the genetic counselors. And if you haven't, then I certainly recommend you check them out, and they're on the website because they're terrific. But you can be referred by yourself to a genetic counselor, or a healthcare provider can refer you. But one thing that I found, in this review, is that interestingly, people who were anxious were more apt to get the genetic testing. So maybe they were, just anxious enough to get genetic testing. And so one thing, as a psychiatrist, I know, and as a person who's lived life, a little bit of anxiety is okay, right? Because that's what gets us up in the morning and makes us do our slides or study for a test. So a little bit of anxiety is okay, but you just don't want the anxiety to go too far. So anxiety does increase the risk of genetic testing. That's really not surprising because they're a little bit worried and they want to get tested. So, and also that if somebody has a perceived risk of a higher risk of cancer, that also increases it. So it makes sense that somebody who has a family history of genetic testing might seek out genetic counseling. So, but what was interesting, and again makes sense if you actually think about it, severe anxiety or severe depression may lead someone not to get tested or even go to counseling because you might be too anxious to get that testing, or frankly too depressed to kind of seek out that information too, because it just may be too much at that time. So the important thing is that if one does go to genetic counseling, they take a lot of information from you, and they take a very thorough history, and they try to look at things that may put you at risk for having distress with this knowledge, and do make appropriate referrals. So this was from the paper, and there were a few individual risk factors that were found to increase the potential for distress during the cancer genetic testing process. So if somebody goes in for the genetic testing, then you have to decide if you're going to be tested or not, and then you wait for that testing. So that distress is measured again, while waiting typically. So some individual risk factors for distress are if you have a history of depression or a history of anxiety, or a history of being on psychotropic medicine, as of being on a medicine to help anxiety, depression. And that all makes sense because if you've had a history of any of those things, you're at a risk of having any of those in the future. So it's not necessarily the genetic testing per se, but just the history. So, and I've already mentioned this elevated risk perception. And then also people who have complicated grief. So unfortunately, people who are seeking testing often do have a history in the family of, perhaps a lost loved one to cancer, or other complicated grief issues. So the family factors that may put you at a little bit of distress, higher risk of distress, are being the first in your family to test, having children, because that if you test and find out that you're positive, that does put you at potential for feeling distress about your children or future children. And then if you've had a loved one who you lost, like a parent who died before you were the age of 13, put you at slightly higher risk. So there are some factors that the genetic counselors and physicians know that might put people at increased risk for the distress. So I'm just going to talk very briefly of this, and I already mentioned this, that once somebody, I talked before about seeking the testing, but then once you're at the genetic counselor's appointment and you hear all of the information, there are people who may choose not to test, even though that might be recommended, and they're called decliners of the test, or delayers. So you don't have to get that test. It's your choice. But some decliners did state that they didn't think they could handle the results. And as I mentioned, this depression can be associated with not showing up for a genetic counseling session. It can also be associated with not choosing to test, or putting testing off to the future. So, but also the depressed individual may, if they're tested and they're found to be positive, may not follow up as much, which again is important for someone like me to be involved, because we want people to always not to be depressed, of course, but we also want those individuals who test not to be depressed, because we want them to be following the appropriate medical guidelines that are recommended. So here's the next part, the test results. And I've really kind of talked already about some of this stuff. There's a slight bump or early increase in distress upon awaiting the results in the weeks to the 1 month that occurs right after waiting and while you're waiting for that result. But it returns to the baseline, meaning if you were a little bit anxious prior to testing, you're going to still be a little bit anxious. But if you weren't that anxious, then you're not going to be that anxious, if you know what I mean. So that some things do show a higher level of distress. So if you happen to be testing in this, in the category of getting your genetic test as a result of also just getting a diagnosis of having, say, breast cancer, then you are going to be more likely to have distress due to finding out that you're at genetic risk, but it's probably related to the cancer diagnosis as well. So the other thing that's important to note is not all these studies say that if you get tested, you're going to have any distress. Some studies showed that there is no increased risk at all. But the other thing that was important that came out of this is that just having a negative test doesn't mean that you don't have any distress. So I'll go on here but if you're found to be a mutation carrier, meaning you have a alteration in one of your genes that puts you at high risk for cancer, then there are all kinds of things that need to happen after that, providing support to you and your partner or spouse, if you have one, and your family members, and then provide recommendations for screening and potentially risk-reducing surgeries. So interestingly, there are some, certainly resources that the genetic counselors know to refer people to. And as I'll mention it later, there are organizations like FORCE, or Facing Our Cancer Risk Empowered, that have support groups for people who have been identified to be positive, and that can be really helpful. So looking long term and looking to see if that person had a little bit of distress upon initial testing, will that be long lasting? The studies showed that there is a slightly increased risk, but it's really similar to, again, that baseline risk of if you're a little bit distressed, that prior to testing, you might be a little bit distressed later. But it really just brings home the point that it's great to have some baseline screening and just know if somebody's struggling or was struggling in the past. So, and let's see. Oh, and so the last point on this screen is the data, meaning the studies, is a little bit confused by people who have had prophylactic surgery. And I'll tell you why in a minute. And prophylactic surgery means that somebody has chosen to have their breast removed or their ovaries removed if they've had a BRCA1 or 2 gene identified, or other genes now, or if they have a hereditary cancer risk of polyps and colon cancer, part of, there's some prophylactic surgeries there as well. So one of the things that was interesting that I found is that baseline anxiety, or people who are a little bit anxious, may increase the risk of what's called a risk-reducing mastectomy, but it didn't impact the risk of a risk-reducing oophorectomy, so meaning the ovaries out. So but age predicted that, and that kind of makes sense, because once a woman reaches about 40, that's when a lot of people are recommending these risk-reducing oophorectomies, or the removal of the ovaries. But for many people, it's earlier, like age 35 or after the completion of child rearing. So the good news is that the prophylactic surgery, or the removal of the breasts or ovaries, does appear to decrease distress, at least in the BRCA1 and 2 carriers. And I should say, again, this is kind of an old review, because I know there's more and more genetic mutations that have been identified since I did that review. So we're almost done here. And then, because I want to make sure we leave some time for questions, but this is an interesting consultation question. So I don't know if people know of Dr. Andrea Pattenow. She was at Dana-Farber for a number of years, and she literally wrote the book called, and I have it here in my office, called Genetic Testing for Cancer: Psychological Approaches to Helping Patients and Families. And that's a really great overview of the history of genetic testing. And it's a great book. It's a little bit heavy on the science. I mean, again, I found it to be very helpful, but the other book, her more recent book, was about prophylactic mastectomies and about women who chose that choice, and a little bit about them. But basically, they were asked if they would or had been offered psychological consultation prior to that surgery, and many of them had not. So, but basically about half of them thought it would have been helpful, and about 2/3 or, more than half thought that after they had had the surgery, kind of wish they had had it, meaning a consultation with someone to talk about it. And of the people who still hadn't decided to have the surgery, all of them thought it could have been helpful. So that's why I sort of started thinking more and more about this and how we could be helping women who were considering this choice. So I'm going to just talk about the risk reducing salpingo oophorectomy. That means having your ovaries out, but you're leaving your uterus in. And that there's been a little bit of research showing that women who chose that, the big thing they would wish for is just a little more information on that they might experience some sexual side effects or like hot flashes or night sweats and things like that. So there's a study, and I put this in here, this MBSR, I'm using all these abbreviations, I apologize. That's a mindfulness-based stress reduction program out of UMass, very similar to Dr. Benson's program. It's an 8-week program. It uses a lot of the same strategies. So they looked at BRCA positive carriers who had had their ovaries removed and who were experiencing hot flashes and night sweats. And they gave them this program, this 8-week program, hoping actually to improve their sexual side effects and their night sweats to see if it did by decreasing their stress level. It didn't, unfortunately, change the sexual side effects, but actually it did improve their overall quality of life. So again, just more proof that it can be certainly very helpful for a variety of populations. So this is kind of an overview, a visual depiction of what I just said. So I'm not going to read you all this, and I can hardly read it myself because I don't have my glasses on. But this just shows that, at different points of time, as you're considering testing, having testing, follow-up, waiting for testing, or being in what's called the surveillance period, the time after you know that you have a genetic mutation and whatever you choose to do, either screening or opting for risk reducing surgery, there are always opportunities to intervene and refer people for any lifestyle intervention programs or referral to sexual health clinics, mental health clinics. There's any number of opportunities. So just in summary, genetic testing really doesn't appear to increase the psychosocial distress globally, but certain individuals certainly do experience distress, and some have the identifiable risk factors. So if you were on that category, a couple categories, if you have kids, if you're the first to test, you might expect a little more distress than somebody who doesn't fit into those categories. So if you might be in that category, or if the genetic counselor suggests you may benefit from some additional social services, we just want to be able to do that for people. And by doing that, we're going to help improve the quality of life, which would also, maybe also prompt somebody to have lower anxiety, lower depression, enough to be showing up for their cancer screenings and their surveillance, and maybe opting for the risk reducing surgeries. But more and most importantly, we hope to improve people's quality of life. So unfortunately, it's not a common practice, in the cancer centers yet, but I do think that we're going in that direction for sure. So these are some of my ideas about programs that we could offer people who are at risk for hereditary cancer syndromes. And they're very similar to the programs that I wish we all could access to decrease our stress and increase our resilience. And they include the mind-body medicine programs, lifestyle medicine programs, alcohol and substance use and tobacco cessation. So again, these are just things that are good for everyone. And then the mental health programs if needed. I'm going to be starting a group in the end of January. It's going to be through the Cancer Center. It's going to be the stress management program. And I kind of talked a little bit about what's in it, not everything. But if you think about it and we're potentially interested and get your care at Mass General, then certainly email me. But these are just some more general helpful apps that I'm also always, and I don't get paid by any of these people. so I'm recommending some, but they're good ones. They're apps to help with meditation and mindfulness. And many of them have little free introductory offers like Headspace and Calm. I included on here a really great 60 Minutes story with Anderson Cooper and John Kabat-Zinn. John Kabat-Zinn is the director of the program of the UMass program I mentioned, the mindfulness-based stress reduction. And so Anderson Cooper goes on this mindfulness retreat, learns meditation, and then they wire him up with some electrodes on his brain and then do a brain scan on him and show how he kind of really can change and relax certain like activated areas that are activated when he's stressed. So it's really kind of neat. And again, I didn't tell you all of the science behind everything, but hopefully I gave you enough of a flavor to potentially be interested and learn more about the Benson Henry Institute and what's done there. I gave you the website there, and they have some podcasts and they have some research papers and they have some free videos and audios on there. So if you had some time and wanted to check out that would be great. This is just a list of some helpful organizations. I mentioned here the top one. Most of you probably have already heard of it. It's called Facing Our Cancer Risk Empowered. It's for hereditary breast and ovarian cancer. And they've just expanded this past summer or maybe fall to broaden, and it's for all hereditary cancer syndromes now, not just breast and ovarian. So I should have changed that. But then these other organizations are for Bright Pink is for younger women, and Shasharit and 1 in 40 are for Jewish women. Because I should have mentioned is that 1 in 40 was started by a local woman because Ashkenazi Jewish women are at an increased risk for BRCA 1 and 2. 1 in 40 women who meet that criteria could have that mutation. So, and then I included that on there, but you can check out all of these if you want. And then those are my acknowledgements and appreciations for all the people who have helped me at Mass General over the years and who continue to support what I'm doing, including my family, of course, and all my great mentors. So I think I'll stop there and stop screen sharing. Oh yeah, there's the last one. My daughter helped me make that little visual on the right. So hopefully I left enough time for a few questions.
Yes, we still do have some time.
Kind of a whirlwind, so yeah.
A lot of great information. Couple questions coming in. I can read them to you. How do you effectively communicate the message of doing deep breathing for stress management and doing it consciously to adolescents in a group setting, as some of them seem to have trouble sitting quietly for a minute, even before the pandemic?
Yeah. Great question. So I'll tell you about, not that I'm putting out there all these different organizations, but there are a lot of great resources now. You know, since this pandemic, I guess that's the only positive, is that a lot of people have pivoted kind of to virtual and putting some things that they were offering in person online. So adolescents, there are some programs that teach these skills, these breathing techniques or brain breaks, and they term it brain breaks and teach kids about the brain. And I didn't go into all the details, but about how we have the prefrontal cortex and the older part of the brain, and teaching the importance of the breathing. But there are programs that teach this. One is Mind Up, it's called Mind, and then it's Up, and it's started by Goldie Hawn, and she worked with Scholastic, you know, the books, and to have a school-based curriculum. They only go K through 8, but there are other programs, and one I recently learned about called Inner Explorer, and that's a program that's K through 12. So there are videos on that website. And recently, the Ohio school system has adopted their curriculum and do that in all of their schools and offer that curriculum. So this can definitely be taught. And at the Benson Henry Center, there is something called the Resilient Youth, and they do offer groups, you know, that break them out to elementary school, middle, high school, and specifically trying to teach some of that. There aren't as many videos per se for kids on there, but there are the free videos for all ages on that website. But I would have people check out Mind Up or Inner Explorer or two potential options.
Thank you. When we talk about stress management, do we really need to cope with chronic stress rather than short-term stress, which seems to have some practical good value, such as doing a job better, meeting a deadline, etc.?
Well, I think that stress management can be utilized for both. And maybe I'm not answering the question exactly, but I'll kind of spin it, is that the stress management tools that, I kind of touched upon and kind of gave a flavor of can help in the acute, setting, but sometimes it's really hard to practice. Like in the stress moment, like if you haven't had enough practice, that's why we do recommend people practice some of these tools with like smaller stress, like in response to like getting a parking ticket. Like that's not too emotionally laden, but you can try doing the breathing then or throughout the day. And that's why if you kind of get it into a habit, one of the things that we teach about in the program is stop, breathe, reflect, and choose. Like if we all just kind of pause after something stressful happened and take a few moments, take a couple breaths, then you're much more apt to choose a response that's a little more balanced and maybe a choice that you would have preferred to make. But if you make it too quick, it would be the one that we might not have wanted to choose. So I think it can be both in the acute stressful event and then the chronic as well.
Thank you. How do I convince my loved one to get tested? Right now, they are too worried about it and don't want to do it.
Okay, so that's a great question. So one of the things that I try to tell people is that, there's no right choice and there really isn't any loved ones to do certain things. But what you can do is provide them the information and maybe give them some of the resources like FORCE or Mass General, the cancer genetic testing, or if you yourself have had the genetic testing or think that would be helpful, referring them to talk with a genetic counselor, because just talking to the genetic counselor, going to the counselor doesn't mean you have to choose to test. But I think it's always important for those individuals to get the most information and then make an informed choice for themselves.
Thank you. Where can I go to have genetic testing?
Well, it depends on where you are, but if you're in Boston area, you're kind of in luck because there's the MGH Cancer Risk Assessment Center, and that's that's right down at Yawkey. And they also do testing now through the Mass General at like Emerson. They send people out to Emerson. They send people to Southern New Hampshire. You can go to Danvers. So there's a number of different places they're now going. And Dana-Farber certainly has a program, but most cancer centers, if people happen to be in Maine or other states, that they have a cancer center that also has a risk assessment center.
Thank you. And I put in the chat box a link to the Mass General Cancer Center risk assessment as well, if anyone would like that. I think we have time for one last question. How can I effectively get out of a worry loop or monkey minds once I am caught by them?
Well, I think that first of all, noticing that you are in it is really important, because I think what happens is that often we don't even notice we are in them. And because we don't give us much time to ever pause and kind of reflect. But frankly, a lot of what we teach in this program is stress awareness and learning to notice that you are having this loop, and then giving yourself to know that you're in it, and then you can just try to gently push that thought aside or that worry aside and bring your attention back to the focus of either your breath or trying to focus on the walk or something in your present surrounding, because we don't have to pay attention to every thought that we have, which is the good news, because our thoughts don't define us. But it's hard to break that train of everyday thought, but just noticing that you're in that worry loop is the first step.
Thank you. That's all the time that we have today. Thank you, Dr. Hirschberg, for this wonderful, insightful presentation, and thank you everyone for joining us.
Thanks so much.
Bye-bye.
Bye.